hey, everyone. Welcome back to another amazing segment of the Black Girl Encourage Her. I am your hostess, Sheniqua Inspires, and I'm sparkling on this day because I've got one of my beautiful sister friends here with me. And you know I can sit here and hype her up, but I'm not. I'm going to bring her to the stage. So you all welcome back to the show, Dr. Katashia. Hey, girl. Hey.
Thank you so much for having me back. I'm truly grateful. It's so good to see you.
It is. It is. Now, listen, you all may remember Dr. K from the Black Girl Encourage Her spinoff, the Black Girl Heal Her series. She came through to one of our summits and she blessed us. And I had to get my girl to come back because, you know, this is Women's History Month and we are talking all about women's health. And there's this thing called perimenopause and menopause that many of us have now graduated into. So I said, let me get us some help. We're not going to be out here struggling and trying to figure it out. The help is here. So Dr. K, before we dive into content, please tell us a little bit about yourself.
Again, thank you so much for having me. And yes, I am Dr. Katashia Kendrick. I go by Dr. Katashia. I am the founder of Dr. Katashia Wellness Collective, where I help women master their hormones and I also help them to relax through sound therapy. I am based out of Houston, Texas, actually.
Love it, love it, love it. So if y'all in the area, y'all make sure y'all check out my girl, sis.
Let's talk.
We have to. We have to. So what's your story? What's your experience with these hormones? What's going on with you?
It's a journey because we met, we talked about our journey through fibroids and living
Yes.
with endometriosis. And now we have transitioned. I want to say transition, but we've moved on to the next phase of one.
Girl. as if the fibroids wasn't enough.
And living with endometriosis.
Yes.
Now I put, yes, I had a hysterectomy, fibroids removed, but I'm still living with stage 3 endometriosis and now perimenopause.
Wow.
And perimenopause, it can start as early, in our 30s, right?
Mm-hmm.
And at 38, that's when I had my hysterectomy and I still have my ovaries. Okay. And I remember last year, which I just sat down to eat dinner. And all of a sudden I felt this heat wave. And it just kind of went through my body, into my head. And I'm like, what in the world? I thought I didn't turn the oven off or the oven was about to explode because I'm like, what's going on? And I sat there and I called my mother. I said, I think I'm having a hot flash. Never had any type of symptoms whatsoever. And that was the first, I'm like, oh my goodness, it's here. That's what I'm thinking to myself. It's here. Yeah. And every so often at that point, it seems like after that first hot flash, they were coming back to back to back. And I needed some relief. And I was just like everyone else, walking around with a fan. I'm cold, I'm hot, I'm cold. My husband and I, we fighting over this thermostat because I'm hot, he's cold. He's cold. And I knew with living with endometriosis, I was a little leery about starting hormone replacement therapy, adding extra estrogen. I was concerned about having flares with my endometriosis because I have been managing it pretty good, symptom free for a while. And I'm like, okay, if I introduce estrogen into my life, what would happen? Yeah. I honestly fought with it for a while, and I decided, you know what, these hot flashes won. I'm not going to be able to do this. I was still sleeping because a lot of women wake up at 3 a.m. I was still sleeping through the night. It was just hot flashes. Okay. And I ended up going to my gynecologist and we had this long conversation. I went to her because you already know I've already done my research. I've done my questions. I went to her telling her, I'm like, this is what's going on. That's right. Because, being in this place now, I already know how to advocate for myself because I know what happened years ago with fibroids. And she was like, On average, if you're already managing your symptoms lifestyle-wise with endometriosis, you shouldn't have a major problem with introducing this low dose estrogen into your life. She said this is a beginner's hormone replacement therapy, in which I already knew that. So I got the prescription, and Sheniqua, I got to tell you, I held that prescription for almost 6 months.
That would be me. That would be me.
Do it because I was still nervous because I'm thinking I'm going to my pelvic PT for endometriosis, anti-inflammatory diet. I'm like, I do not want to, fall back into where I was dealing with this when I was first diagnosed with endometriosis. And so I decided to take it.
Mm-hmm. So let's pause right there for a second. Let's talk about
that was the best decision ever.
Okay, so let's pause. Let's talk a little bit about this because you keep saying endometriosis. So let's talk to the women because maybe some have it and maybe some don't even know or whatever. So let's talk about what your life with endometriosis is like. So what is that and what does that look like for a woman?
So endometriosis is an inflammatory condition, a whole body condition. A lot of times people think it's a reproductive condition, and it's not. It's a full body condition that it can literally live everywhere in your body. It is where endometrial-like tissue, it looks like it, but grows on the outside of the uterus, and it can grow. It can be on your intestines. It can be in your chest. It can even travel up your lungs and even travel up to your brain. I always tell women it's sticky. If you think about Spider-Man and his web, it grabs on the things and it just won't let go. So that's why a lot of women with endometriosis deal with constipation as well, because it's on the bowels and it kind of just hold on to it and in different places in your body. And it can cause, it can be really painful, especially during your period time where you're thinking that, oh, I just have bad periods. And a lot of times for me, when I realized that I had endometriosis, because it was severe pain to the point where I thought it was just my fibroids in it, and it wasn't. Okay. So living with endometriosis, a good for me, it was pain medication. The doctors just kept giving me pain medication to take. And I'm like, there has to be another way to live and manage these symptoms without it. And so that's when I started doing more research. And then holistically, I decided to do an anti-inflammatory diet. Got a lot of things out of my diet. No, I didn't go gluten-free, but I most definitely, limit my sugar. I don't drink alcohol, and those things remove the toxins from my life. Toxins meaning I stopped using dryer sheets and things that I put on my skin and things I put into my mouth. That helped to reduce those flares that I was having. And then what really changed, it made a difference. And even pain during sex, that was the worst. And the inflammation of it all, because you can be really bloated. It's just a lot of things that can happen with endo. And I started to go to a pelvic PT, and that made that was a major difference in my life and being able to manage my symptoms. She was able to give me techniques doing vaginal exercises, meaning there was different dilators that I can use, that we use to help me to be able to tolerate the pain. And it can actually different things and pinpoint different areas in my body, in my vaginal canal, to help me with those symptoms. And now I can do that at home. I don't have to go to her to actually do it. So that was one of the ways that I actually managed my endometriosis for a long time with no problems. Okay. So that's why I was concerned about adding estrogen to my body. Estrogen can flare it, because this is a estrogen dominant type of condition. And I was concerned about that. And with getting that prescription, I waited some time before I even filled it. And like I said, the hot flashes won. And I needed some relief. And I started on beginner HRT, which is the patch. So I know we're going to go into, this is just my story. I know we're going to talk about different formulations. Sure. I started on the patch, and the patch, you do it about twice a week. You change it out. And when I tell you, it was the best decision I ever made. I haven't had a hot flash since.
Now, was hot flashes the only symptom that you were experiencing?
That was the only symptom I was experiencing. experiencing, and it was unbearable. And I remember when my mom years ago, we were in, at that time it was called Goldsmiths, but it's Macy's now. We were in the line to check out, and the lady kept asking my mother for her card, and my mom had the card in her hand, and she was just stuck, and sweat was just coming down her face, and I didn't know what was going on with her, and I just took the card, paid for our things in Macy's, and we left and we went into the restroom. And at that time, she was like, I was having one. And I didn't know, again, I'm young. I'm like, I don't know what you're talking about. And she's, I was having a hot flash. And I always think about that moment for her, because she was literally could not move. She was frozen. And I think about that, and even now in my journey, now that I'm 48, I'm talking to my mom who's 79 about the things that I'm going through. And she was like, that's really the only thing I was dealing with back then. But now we started thinking about other symptoms like frozen shoulder. She was like, I've always had issues with this. I thought it was just arthritis, but it could have been perimenopause. There's so many of these weird symptoms that, you know, ringing in the ears that people keep saying, you know, talking about. But for me, just a hot flash, and I decided to start on the patch. And a lot of times with me not having a uterus, it was okay for me to do estrogen alone. But if you do have your uterus, you want to take estrogen and progesterone together. So that was the caveat when starting that. So I didn't have to worry about that. But I wanted to take progesterone because I wanted to mellow out. I felt like, even though I told you the only symptom I had was hot flashes, but I felt like I can get irritated and snappy with my husband sometimes going with him. And I was like, okay, my mood was a little different. And so that's when I did go back and I discussed progesterone with my provider. And so I started taking progesterone to help, because it's like the mellow mood, right? And when I did get my labs done, it was on the low side. So we decided to go on progesterone to help get that up, because I want to be kind of smooth and mellowed out a little bit.
Yeah. All right. So in case you all don't remember, Dr. Katashia is a pharmacist in training. And so this is the reason why I asked her to come here to talk about medications. Not necessarily for y'all, but for me. Okay. Let me just be honest here. This conversation is me and Katashia kind of a conversation where I normally could have just called her up and like, sis, like, come on, talk to me, help me through this. But I said, you know what, let's do it on the show, because I know I'm not the only one. And so I wanted to bring forth this information. And I have to be honest with you all, I am very, very weary about medication. So I'm going to have this conversation, nurse to pharmacist, right? I, as a registered nurse, am very, very weary about medications, because we know that you take one medication for one thing, and then it has this whole host of side effects. And then you need another pill to combat the side effects from that. And that pill has side effects. And then you're just down this kind of rabbit hole. And so that was my halting of it. My mother had, an experience with, I believe, perimenopause, menopause for sure. And the thing that I knew about my mother when it pertained to menopause was that she was taking estrogen. And let's just have a real conversation. My mother is in her upper 70s now, so I don't think she minds me talking about this now. But one of the things that scared me about the menopause journey, even about the hysterectomy journey, the menopause, all of that bottled up based off of what I saw. One of the symptoms that my mother used to, well, she didn't talk about it, but one of the things that later on she discussed was the low sex drive. So in my mind, I'm like, whoa, I don't want that to be my story. And it seemed as though the older I got, the fear really started to take a hold of me. And so I didn't want any medications, and I don't want this, because I'm afraid of repeating the same symptoms that my mom experienced.
Mm.
So what would you say to someone? I mean, well, you kind of already said it, like, like you're loving the medication, but what was it? Was it just that your symptoms were so heavy, the hot flashes were so unbearable that you just folded, you just gave into it? Or what was that turning point for you to say, you know what, let's give it a try?
That's a great question.
Mm-hmm.
You know, pharmacist by training. I've been a clinical pharmacist now for 20 years.
Mm-hmm.
And I must say, research. I have it in front of me all day, every day, reading it, helping patients in a hospital. But I must tell you, when I was in pharmacy school 20 years ago,
Mm-hmm.
there was a study called the Women's Health Initiative. And at that time it said no to estrogen, basically. The breakdown of that was like it was not good for us. We should not
Mm-hmm.
take it. It caused breast cancer.
Mm-hmm. Mm-hmm.
Doctor on earth. And
Yeah.
so for 20 years, it was a no, right?
Mm-hmm.
Last year, they came back and said, sorry or oops, that's not the case.
Yeah.
I'm making light of it, but basically
Yeah.
that's what happened. And I would say this about, for me, when I decided to do it, one, I did read the research. That was
Mm-hmm.
important to me. I wanted to know, because I remember in school how that was the biggest talk, no to hormones. And remember, the hormones that they were talking about was synthetic. It was
Mm-hmm.
been made by horse urine, and also
Mm.
they used
Ooh.
it wasn't progesterone they used progestin. So
Mm.
different medications that they were talking about in this study that versus the ones I'm talking about right now.
Okay.
You have synthetic hormones and you have bioidentical hormones.
Mm-hmm.
Synthetic hormones are the ones I was just talking about, made by horse urine with the estrogen, just synthetic from different chemicals being made. You have the bioidentical hormones that are very similar. Bio meaning similar to our body, what our body makes.
Mm-hmm.
That's the one that I actually take, and that's the one I always I give both. I talk about both to women, but of course I'm an advocate for the bioidentical, but
Mm-hmm.
that is my opinion. But I bioidentical is the estradiol, and then you have progesterone, what I just mentioned, which is
Mm-hmm.
bioidentical. So when I started to read this information, I'm like, well, for sure I want bioidentical.
Mm-hmm.
um, let's see what else I can do. Oh, I can do beginner, meaning that there's something that's simple, that's easy. I'm not having any type of symptoms down there right now.
Mm-hmm.
I am having these hot flashes, and I decided to go with the patch because it can still work throughout the body systemically for
Mm-hmm.
things down there and also the hot flashes and things like that. So that's why I decided to go on it. And because of brain health, we think about, oh, I'm just going to thug it out. I'm going to thug this menopause out, when we really
Mm-hmm.
thug it out, because our bodies we have estrogen, we have progesterone, we do have testosterone. And in this time of our lives, yes, those levels in perimenopause is all over the place, right?
Yep.
It's up and down, up and down. It's, that's when the hot flashes stop and they go back to this versus
Mm-hmm.
get into menopause and it's down. So what do? Our body is not making it anymore. So we need to replace it, right? And I know women say, oh no, I'm not going to do it. And I must say there are absolute contraindications where some women cannot take hormone replacement, and we get that, right? But
Mm-hmm.
also there are women who are able to, but also scared to do it. And if
Mm-hmm.
you're scared to do it, meaning that you're able to take it, but you just don't really know, just know this is replacing what your body is losing, right?
Mm-hmm.
And you saying that bioidentical will probably be maybe a good start for you when it comes to hormone therapy. It helps with heart health.
Mm-hmm.
Heart disease is the number one killer in women. And with estrogen is a part of that process. If you don't have, and if your estrogen is going down, then heart disease and all other things happen. Your cholesterol is going up. That's why in perimenopause, you see a lot of women, my cholesterol is going up, my weight is going up, diabetes, all those things. And that's
Right.
comes into play. When you think about brain health, dementia, there's some research out there about estrogen levels and dementia. And I think about Alzheimer's when, again,
Mm-hmm.
going down, and what do you do about that? So I started to look at those things. I don't want to have a stroke. I don't want diabetes. I don't
Mm-hmm.
these things, but if my levels are constantly going down, I'm not doing anything about it. Bone health, don't let me forget about that.
Yes.
Osteoporosis is another thing in
Mhm.
menopause that we got to be concerned about, because now estrogen going down, we can increase
Mhm.
our fractures. So you
Yeah.
want to get those things. So that was my turning point for me. So
Okay.
what do I do? Because we've talked before, I'm really big with working out and watching what I'm eating and just living a
Mhm.
really pretty good lifestyle. And I don't want to have that fear saying that something I could have done to prevent a heart attack, to prevent
Mhm.
all these things, breaking a bone. Because this is a side note. I was living in St. Louis at the time, and the lady I worked with, we were talking, and she said her friend stepped off the curb
Mm.
and broke her leg, and
Mhm.
doing all these things, hip broke just by stepping off the curb, and she wasn't on hormone replacement. But again, I thought about that when I
Mhm.
started going through this process, because back then that wasn't on my radar, perimenopause,
Yeah. Yeah.
fibroids at the time. But now,
Right. We were preoccupied. Excuse us.
but now that I'm in this season, I remember that story with her, because at that time it didn't make any sense to me,
Yeah.
but now it does. So
Yeah.
all those things came into play for me when I decided to just start estrogen. I don't have any contraindications, meaning any reason I couldn't take it. So
Mhm.
I decided to start with estrogen for me, wanting to save my life, because I'm thinking like long term, when it's
Mhm.
about brain health, heart health, bone health. That's one of the reasons why I started estrogen.
Yeah. Okay. So
Outside of, burning up.
listen. The internal inferno is enough to make you want to do that,
Right.
right? Okay. What is this black box warning?
So that's a great question, because that's what I
Mhm.
was talking about before with this. I'm just going to go ahead and just talk about the different formulations. But before we get to the formulations, estrogen had this black box warning on it,
Mhm.
basically saying, stop. This is
Mm.
not safe for you.
Mhm.
Stop.
Mhm.
Just reconsider. If you have issues with cancer, stop. Of course. If you have issues with blood clots, yes. But it was just across the board blanket stop. No woman could take it. And
Mm.
that was including the vaginal estrogen.
Mhm.
So
Mhm.
what do I mean by that? Vaginal estrogen does not go to through your body. It's local, meaning that if you put it right here,
Mhm.
like if you put it right here, that's where it stays. It doesn't travel through the body. So when and that black box warning, the doctors were even scared to prescribe vaginal
Mm.
estrogen because of that. And
Wow.
women were dealing with recurrent UTIs. Women were dealing with itching and pain during sex and all these things. And they were just suffering basically because the doctors that black box warning saying stop. So that was
Now, was that for all estrogen, or was that just for maybe like the bio, um, the one that's more bio identi? What it was
all
it bio?
it was across the board.
Okay.
So,
Hmm.
but what the thing is now that the research says something different, now it's like, okay, we can prescribe, and most people are still, a lot of old school doctors are still like, I don't know yet, And my
Mm.
thing is, if your doctor is still telling you no, and you don't
Mhm.
have any type of issues, not to take it, then I will probably get a second opinion, because
Mhm.
the research is there. Because I had just received a question the other day: is HRT safe?
Mhm. Mhm.
Is it safe? Is it safe for me to take? And I would say that the research, based on evidence, that taking estrogen for a woman, I don't want to say, oh, it's safe, you can take it, everybody's good. I'm
Mhm.
saying that after your doctor has evaluated you and you have no issues in taking estrogen and being monitored, you should be fine.
Mhm.
So, for
Mhm.
instance, for me, I am taking estrogen. No, I don't have any issues where I couldn't take it, but my doctor I'm following up with my doctor. We're getting my labs done. We're checking symptoms. And what's most important is my symptoms. I haven't had any symptoms since starting. And that's one of the main conversations we have. Because regardless of my numbers, how do you feel? And
Mhm.
I feel amazing. Even when I walked in the doctor's office in December, she said, "You like a totally different person."
Mhm.
She said, "I look like I was beat up when I came to her office," and we laugh now because
Mhm.
I was suffering at the time. So
Yeah.
I always am gonna advocate for you to, talk to your provider. Also know the information saying that, okay, I know now that estrogen is safe, but I want to, I'm not having symptoms, but I feel like something's off. I want you to, to have that conversation with your provider, and then know the different formulations, right? I know we're going to get into that, but I always call it dose because I'm a pharmacist, DOSE. So that's how I remember to talk to women about hormone replacement. Dose means things that are delivered by injection or inserted. So what formulations fall under that? You have estrogen in a solution, and you have the pellets. You probably heard of the pellets, possibly. So those are inserted in the fatty part in the upper part of your buttock, and then you have an injection, like if you give yourself a shot. That's probably not as common, but it's really good, meaning by you get 100% of that medication through that. When it comes to the pellets, though, a lot of doctors, I literally was on a panel a couple weeks ago, and I don't prescribe, I don't diagnose, I do educate as a pharmacist. One of the ladies, they talked about the pellets, and every OB-GYN on that panel started cringing and moving in their seats. They just hate the pellets, right? And there's pros and cons, honestly. And I feel like, ladies, that we need to be flexible and open-minded when it comes to HRT, because even though the patch works for me, one lady said, I hated the patch because it never stayed on. So that's what I mean by these different formulations. You really got, it's like trial and error. What works for me might not work for you. And for the pellets, a lot of times, I think the pellets should, for me, if I had to make a recommendation, that it would probably be the last thing I would do. Because I consider that, that's the top, you tried everything else. Let's try this one. If you're brand new to HRT, I would recommend the patch for sure. That's pretty simple. You can put it on twice a week. Your doctor can adjust the dose because it comes in different strengths. When it comes to the pellets that I was talking about, once you put it in your body, you can't take it out. It's there. It's just like or anything else you inject or insert into your body. So say, for instance, you start having all these side effects, or you're not feeling like yourself, there's nothing you can do but kind of wait it out until it's gone out your system. So that's what I mean by dosing, dose things that are injected versus things are inserted. When you come to oral formulation, taking it by pill. Pills, when it comes to estrogen, not my favorite, because you must be the estrogen must be metabolized through the liver. So that's a whole nother thing right there. Also, it puts you at a higher risk for blood clots when you take it orally. So again, not my favorite formulation, but there are some people who would rather take the pill, but most definitely make sure you're being monitored by your doctor.
Because that's kind of like into the birth control pill and how they recommend women of a certain age not be on the birth control pill. So
right. Put yourself at risk, because of course birth control pills and HRT are totally separate things. Birth control pills, suppresses ovulation, but this is what we're trying to replace back into our bodies because we're losing it. But oral formulation is still there. Progesterone is oral. I take progesterone orally. But there are some people who can't take progesterone, that bioidentical I was talking about, because it's an orange. It looks like a little orange. It's an orange little capsule. There's dye in that orange dye, or there's dye in that capsule, and it's made with peanut oil as well. So if you have a peanut allergy or certain dyes, you're allergic to that, then you're not able to take that type of bioidentical progesterone. You may have to get it compounded, and that's okay, because now there's no dyes there, and it's made with a different type of oil where you're able to take it. So that's still a possibility when it comes to oral formulation. And a lot of times when we talk about hormone replacement, we usually talk about estrogen or progesterone, but there's also testosterone out there as well. I know you mentioned libido, and that was one of your main. And a lot of times, for just me being transparent, before I started the patch, I had issues. It was just like, yeah, that's how I felt. I didn't have to do it. But it seemed like as soon as I got my patch on and started, getting it through my system, I was ready. My libido it kicked up. So it all
Mhm.
depends per lady if it comes from estrogen or testosterone. But those are conversations that you have with your provider. But
Mhm.
next out of dose, we did the D, we did the O, now we have the S.
Mhm.
Things that are skin applied. So that's the patch that I mentioned, right? And you also have um E, which is easily absorbed. So that's the creams that we talked about.
Mhm.
Is things that are inserted. So you ever heard of vaginal inserts that
Mhm.
that can be absorbed as well? You have creams, and then you have the ring. You have that as well, a vaginal ring. You have
Mhm.
different things that can be inserted or easily absorbed, and you can also take a sublingual formulation that you can cheek it, and it can dissolve. So it's so many different ways that you can get your hormone replacement therapy. You just need to know which one works for you, because what works for me might not work for you.
Now, question for you. Was your estrogen level low when they started you on the replacement, or just you going to your GYN saying, hey, I'm having these hot flashes, what can be done, and they offered it to you?
So one of the conversations we had, and of course this is something I wouldn't tell her, being that she was like in perimenopause, you just never know where you will fall, especially when you come into the office and get your blood work. I wanted
Mm-hmm.
my blood work, and also we talked about my symptoms, and my levels were low.
Okay.
My estrogen level, estradiol level was low, and I also did a test on myself. Did a Dutch test, and I
Mm-hmm.
put those results in there as well. So I knew that my levels were low.
Okay.
But again, like I always tell my clients when I'm doing education, if you have symptoms, then you have symptoms, regardless of what your levels are saying. So having that conversation and being open with your providers, like, no, I'm having this, I'm having, hot flashes, or I'm having difficulty with pain during sex. So all those things tells her, oh wow, she's having this vaginal dryness, she's having pain during sex, but also she's having these hot flashes. That helps her determine what formulation to recommend. Because I get
Mm-hmm.
this question all the time as well. Well, can I do bioidentical and the creams? Can I do both? And you can. Because remember, the cream is local. You put it right on your in your vaginal area, and which is only going to help you with the dryness, recurrent UTIs, all that. But then
Mm-hmm.
if you take it by mouth, or if you're injecting it or whatever, it goes in systemically, meaning that it takes care of your body and the hot flashes and those things,
Mm-hmm.
bone health and all those things. Because the cream won't help you with bone health. The cream
Right.
is
Okay.
not going to help you with brain health or
Mm-hmm.
heart health. That's just local. When you take things systemically, if you're injecting it, if you're taking it by mouth, that makes a difference with helping with that.
Okay.
I hope
Now, I
that
do.
you open this. That was a lot.
No, no, no. That was extremely helpful, because at least now, if women are experiencing these symptoms, they can now go to their doctor and start a conversation. Because truth be told, I have had a conversation with my GYN doctor, and what he said to me was, you know, depending on what your symptoms are, we can get you started on something, right? So he led me to believe that there was hope. But then when my blood levels were drawn, because my estrogen had not moved, they were like, no, you can't have it. And I'm like, but I've got symptoms. Like, what do you mean? Now, mind you, I don't really want the medicine, but I want you to offer me the medicine so then I can sit on it for 6 months.
You sit on it like me. Sit on it for 6 months and let me decide if I want to do this.
Right. Let me get my mind wrapped around it first. But I don't want you to tell me that I can't have it. And I even went to a specialist per se, and she just dismissed it.
Hmm.
And I have to say this, and I hate to say this, but I have to say it. She was a woman of color. And I don't know why I put all of this great hope and women that look like me. I put all of this great hope. I sorted through all of the names and I had to find the one who looked like me. And she was very dismissive. She was very dismissive, all because my estrogen level, now, mind you, my progesterone level had gone down, but my estrogen level was basically normal. And I'm like, but you can't tell me that I'm not in perimenopause because I'm not so much having hot, and that was the thing, because I wasn't having hot flashes, it ended the conversation for her. So hot flashes to her was the green light that it was perimenopause. Regardless of where your levels are, if you had hot flashes, it was like, okay, we can have the conversation. But because I've only experienced hot flashes like here, there, like not really consistent, it was like, nope. That was it. And that disturbed me because I'm like, well, wait a second. At first, I thought my original GYN doctor was like, oh, yeah, we can have this conversation, when you're ready for it. And I'm like, well, now I'm ready for the conversation. And I'm being shut down because I'm not having hot flashes. But the brain fog, the moodiness, everything else. Everything else, the cholesterol level going up, the blood pressure being out of whack, like everything basically else. But if I did not have the hot flashes, then it was like shut down.
Let me ask you, because I know a lot, this is a conversation I have with gynecologists as well. A lot of times, they, we always hear about estrogen replacing that, but a lot of doctors I've talked to have a conversation with, gynecologists, and they talked about a lot of times they don't start with, even though they listen to their, patients regarding their symptoms, but a lot of times they don't start with estrogen first. They actually start with progesterone first. And it all depends on the doctor and how they, of course, treat their patients. But a lot of times they feel like progesterone, of course, is the first to start to decline versus estrogen. And a lot of times by starting that first, they noticed that their patients started just to feel better. They started to feel like themselves. The moodiness, the irritability, the brain fog, just by adding on that progesterone. So I was wondering, when you had that conversation with your provider about that, was that an option to start progesterone? Let's start you there.
Nope, it was a shutdown. Once I said I didn't have hot flashes, she says it's not. She's like, it's not perimenopause. It's not menopause. It's not perimenopause. That was just it. She was like, you want to see a nutritionist? What else did she say? I think that was basically it. And she offered me something else where I don't know if she does a pelvic exam, and I'm like, miss, I don't really trust you now. Like, I don't want you all up in my stuff now. And I was just like, no, I'm good. Like, whatever, I'm good. She's like, well, do you want me to draw blood work? No, nope, no, thank you. I'm good. And I left. But then I felt defeated, right? And it's a similar story with my fibroid journey, right? You meet these practitioners, and then all of a sudden you feel defeated. And I don't like that for us. I don't like that for anyone. But I'm glad that you came on to tell us about these medications, because at least this way we go in and we can do the research. We can ask the right questions. We can say the right terminology, right? We can then say, if they shut us down, we can then say, well, wait a second, what about starting on progesterone? Like we can now advocate better for ourselves.
And that's one of the things I'm so happy we crossed paths in this lifetime, because I know we both started in, this journey talking about fibroids, and that's how we met. And to be here now I feel like now in this space, yes, I work in women's health. Yes, I know what to say now, but just imagine the things we could have said back when we started this, back on our fibroid journey. So that's why I do the work I do, is to be able just to have a workshop, explain to you what medications are out there, what you should be asking. Because I was at a workshop before, and the lady told me she kept having all these issues with progesterone, and come to find out, she said, I have a peanut. When I mentioned a peanut allergy, she had no idea. And she's been taking it, and she stopped. She said, I kept getting this high. Something was off. She was like, but she never thought it was that. So it's just little conversations like this.
Necessary.
It's necessary.
All right. So I do want to backtrack to one thing you said earlier about you were reading through the research, reading through the research, reading through the research. Now, come on, give us the goods. Does the research include Black women? Like, because a lot of, let's just use the blood pressure medications. Yeah, there's loads and loads and loads of medications out there, and there's loads of research, but the research never really was including or inclusive of women of color. It was always other people. And so they give it to us, and then we start having signs and symptoms that they didn't know was going to happen because it wasn't necessarily made for us. So, what is the research looking like?
And now it's still limited. I won't sit here and tell you that it's like all the Black women in studies, but I believe that like the numbers are limited. My best friend, she's a scientist, and she actually, encourages. She goes out just like me doing workshops, encouraging African Americans, Black people about research and how it's actually handled, the safety, informed consent to get more and more people into these studies. Because if we don't sign up to get in these studies, then we won't be in the studies, and then the research will still stay the same, and we can't. They're gonna continue to extrapolate, from the studies from white people, Asian people, white men to us. So that's one of the things I always talk about is like we got to be in the studies. It's really good what We Can Wear White and other Indo-Black are doing more studies for endometriosis and fibroids, and that's great. But we got to do it for all, not just women's health, but heart disease, for osteoporosis. We need us in these studies to be able to extrapolate that to us. But to answer your question, it's not that much. The information out there is great, but of course, there's not a lot of African Americans in studies, and we just need to sign up. And I think the education is out there, and I think my best friend is doing a really good job and getting out there, letting us know about the research and why it's important to get into these studies. Because otherwise, like you said, how would we know what works best for us if it's only 5 or 6 of us in the study?
Yeah. And you got to connect me with your best friend, because I want to be able to support any which way I can. I want people to know that help is available, because honestly, like, we've struggled too long, right? Like, my fibroid journey was years. And it's like, I think back on it now, like all of the suffering, all of the turmoil that I had to endure. And I don't want that every time we come to a new stage. Like, I don't want to have to go through that same struggle. So I don't want to have to struggle through perimenopause, menopause. I don't want that to be my story. So I said, we got to get together. We got to talk about it and see what we can do to try to alleviate some of these symptoms, whether it's starting the medication or whether it is alternative things. So I know you do a lot of other things, like you mentioned, like the anti-inflammatory diet for your endometriosis, but that could help, with hot flashes and everything too, right? So it's a good. What other holistic approaches can people take if they are experiencing some symptoms of perimenopause, menopause?
And it's great that you mentioned it too, because a lot of people will just say, no, I'm not doing hormone replacement therapy. They're like, I'm just going to stick. And I was just telling my husband this earlier, that anti-inflammatory diet just doesn't help with perimenopause and endometriosis. It can't help with most of anything that we're dealing with right now, because if it's hypertension or high cholesterol, those things can anti-inflammatory diet can't help. But I know women always ask, so, well, what else can I take, or what can I do? They always talk about magnesium. Taking magnesium to help, just because magnesium is a part of so many systems.
The glycinate, right? Magnesium glycinate.
Magnesium glycinate, for sure, is one of those ones that I recommend. Omega-3s, EPA, because of inflammation, that has been really good. Now, if you have issues with clotting, that's a whole nother story. But just generally, omega-3s. And people ask about herbs. What about that? And there's people mention black cohosh and all these things. I must say, The herbs are great, but people think that if you drink a tea today, that my hot flashes are gone.
Mm-hmm.
I'm good.
Mm-hmm.
I
Yeah.
must say, if you take an herb of, holy basil, whatever it is, you got to continue to take that over time, right? It doesn't happen overnight. And I think that there are great, because someone will tell me, oh, I took that, it didn't help me. But I always ask, well, how did you take it and where was it sourced? Because I always ask, like, where did you get it from? I wouldn't buy my herb from, I'm just saying CVS or Black off the stuff like that. But you want to make sure, where did you get it from? Where was it sourced? And how long have you been taking it? Because I can tell you that it doesn't happen overnight.
Yeah.
I love passion flower. A lot of people, when it comes to people will say, oh, I tried melatonin to go to sleep. Oh, I tried magnesium to go to sleep. And I would say, well, have you tried passion flower? It's so many other, herbs and things holistically that you can take to help relax your body.
Yeah.
I love sound therapy. I think I mentioned before, sound therapy is one of those things I never thought would leave my house, because I feel like true healing really do start with your nervous system. If we're always on fight or flight all the time, then how really going, meaning that you're going to start this healing journey. You got to really take a moment to pause.
Yeah.
15 minutes, 30 minutes a day to help kind of just calm your nervous system, just taking your wellness to another level. And that's how I got into sound therapy meditation through my infertility journey. It was rough. Those streets were rough. And it helped me kind of navigate that. And that's why I mentioned earlier, I'm helping you master your hormones and also help you to relax. And those two things can help you on this journey of perimenopause as well.
Yeah, because honey, I'm telling you, there's certain and it's almost like into a cycle for me, because it's like certain times of the month, like not all the time, but certain times of the month. And because I don't have a cycle, I don't really like track it like how you track your cycle. You're like, oh girl, it's my friend get ready to come, So it's like it's annoying in the sense, but like I can feel a difference where my sleep starts to be disrupted, or I just feel tense, or feel like it's hard, like winding down. Like I love ashwagandha. Ashwagandha has been a big help for me. I do the melatonin, I don't take it all the time, but when I get into kind of that time of the month, baby,
that's
one
of the ones you shouldn't be taking all the time. That's one every once in a while. I have a question for you, if you're willing to share.
Yes.
I know you mentioned, your concerns and I don't know, side effects. If based on this conversation that we've had today, would you even consider progesterone?
You know what? I probably would. And that's the honest truth. Because I want help. Like I don't want to suffer for 6 years like I did with the fibroids. I don't want to do that. Right. And my blood pressure and my determining factor is the fact that my blood pressure, because like you're not the only one, says I was doing the same thing. I went to the doctor, my blood pressure was elevated. They gave me a prescription. I held on to it. And I'll tell you something funny, because you're a pharmacist, you would get a kick out of this. One of the medications that they gave me for my blood pressure, losartan, it has the letters Satan in it.
You're like, no.
So she wouldn't take it.
Okay.
Now look, listen, Christians, don't do this silly. Don't do this. Don't do that. Don't do that. Right. I'm not saying that was the right thing to do, but that's where my mind went. And I was like, nope, not taking it.
You took the whole R out of losartan. You like low Satan.
I saw Satan had the letters SATA. Now I was like, no. But I was still struggling, and I was trying to, I was exercising. I was trying to do everything on my own, but my blood pressure was still elevated. And finally, I went to a cardiologist who I connected with, and she was like, I was getting ready to go in for my surgery for the fibroids, and she was like, listen, you don't want them to turn you down for the surgery because of your blood pressure. So she got me, cool enough, and she didn't give me the losartan.
She didn't give you low Satan.
No, yeah, exactly, right? She was like, no doses of Satan over here. So not even a low dose. I don't even want a low dose of Satan. And so she, she convinced me. She was like, Sheniqua, she's like, there's plenty of other she was like, this. I was like, I know. But she convinced me. So I did start taking a medication for that. Had my surgery. The blood pressure came down. I was like, I'm healed. I'm delivered. I'm set free. So I stopped taking it. And then, of course, it started coming back again. And I kept saying, I was like, Sheniqua, you don't want to have a stroke. Team no stroke. That's what I used to go around saying, team no stroke.
I'm with you. I love that.
And so I started taking the medicine. But I understand that there's a number of other things that are predisposing me. It's the age, it's the ethnicity, it's a lot of stuff going into it, right? So the question you posed to me is the same question to the audience. What's your turning point? Mm-hmm. At what point do you say, you know what, enough of the struggling, enough of the worryation, like when do I seek out help?
Yes, and I think that's when, for me, when you mentioned, the question, what was your turning point? What happened mm-hmm. for you? When my weight kept going up and nothing's mm-hmm. changed, when mm-hmm. my blood pressure is going up, and just like you, my doctor said, mm-hmm. you need to consider blood pressure medicine. I don't team no stroke, just like you, right? I'm thinking like, I don't stroke. Going through all these things. Yes, I started blood pressure. I was like, I'm not doing cholesterol medicine. My cholesterol, everything was going up. Mm-hmm. And I didn't make a decision. I know I was transparent. I told you I started estrogen and progesterone, but I also started a GLP, a peptide. I'm pretty sure everybody heard about the brand names such as Wegovy or mm-hmm. Mounjaro or Zepbound. Zepbound is for weight loss, and Wegovy is for weight loss. And I started microdosing it mm-hmm. About 6 months ago. And I just saw the inflammation leave, like it was down.
And you look good, girl. Let me just say you look good. Because I saw you at that gala. I was like, come on now. Come on now.
Better. Can I tell you? Because I'm thinking my diet, nothing's changed. I'm like, what's going on with me? And of course, perimenopause, I decided, you know what? I'm doing it because I'm trying to save my life here. Mm-hmm. And so I decided my insurance did not pay for my peptide or my peptide. So I got it through a company, a compounded version of it through a company. And I love this company because you're able to customize what you put into your peptide. So I have B12 and B12 and the tirzepatide together. So I take those two together. So energy and weight loss. And I've been doing that for, I did the microdosing, which is taking smaller doses because I didn't know the side effects. So I know how you are about side effects. Yeah. Side effects with your stomach. And I was a little concerned, and small doses did really well on it. And so I actually started doing the full dose in January. When I tell you, clothes clothes, of course, are bigger, but that's not the major concern. I don't care about losing the weight. Mm-hmm. My cholesterol is down. Mm-hmm. My blood sugars are so much better. Okay. My blood pressure is better. So she told me, we were talking, I'm like, a couple more months, I'll be off my blood pressure medicine. So that's why I started to take this, because I saw what my numbers were doing in perimenopause. And I'm like, I'm not doing anything different. Mm-hmm. So that was another option for, ladies to think about. There's research out there about taking peptides, which is tirzepatide, along with hormone replacement therapy. And it's been amazing. I'm one of those people that tell you I'm on both, and I'm feeling really good in my own skin right now.
Yeah. And to me, that's what's important. It's about the longevity. It's about the quality of life, right? And not the day-to-day struggle and this, that, and the other. So I'm so grateful that you stopped by to just give us some information. Like, let's just have a girl talk, a chit chat. Let's just put the cards out on the table. And so at least this way, we're a little bit more empowered to advocate for ourselves. And again, everybody is different, right? So everybody's you got to figure out what works best for you. So it's not, because I say, I'll take progesterone, you want to run out and get that. No, we're not recommending anything. We're just giving a chat on what it is that we would be willing to do, what Dr. Katashia is doing, and what has helped her. Like, that's her personal testimony. And then it's up for you to say, let me go and get my own experience. But part of the reason why we don't get the help that we need is because we're scared. We saw somebody, like I'm basing it off of something that happened, with my mom 30, 40 years ago. And it's like medication has changed since then.
It's changed. And of course, research. I mean, one of the questions, one of my mentors, I will say this, I know we're about to go. She asked me and she's a dietitian actually. And she mentioned to me, if research wasn't behind a medication and it could save your life, would you take it? I'm like, what do you mean? She said, it's an investigational drug, because you know about investigational drugs. She said, there's not a lot of research behind it, but it could save your life. It's a possibility. 50-50. What would you do? And that's always been in my head about certain things, because people, I know I call myself a unicorn in this space, because holistically, I know there's alternative ways that you can heal your body without medications. And I do know about medicines. So that is always in my head when I talk to people about research, but also there is things out there that can most definitely help you turn your life around, and there's not a lot of research behind it. So I always tell people to be flexible and open-minded when it comes to, because you have some doctors like, no, research, and you have some say, you know what, it's a possibility. There's investigational. It can possibly help you. So just keep that in mind when you're on this journey, because like I said, what helps me might not help you, but it's just giving the information. And like right now, if you go back and say advocate for yourself, you say, you know what, I'm looking for progesterone. I'm interested. Let's start there. I'm always here to help you. Say, hey, call me anytime and say, hey, I'm thinking about this. What do you think? And I'm here to help you. I mean, because we know each other. But I also just want people to keep an open mind to the treatments that's out there to help them through this day-to-day space, because it's real and we shouldn't be suffering just because we're scared. We need to know the information, get to know the information, and advocate for yourself in the office.
That's right. That's right. I love it. And truth be told, we have information, we have the research, we've got the science, we've got everything backing it up, and people still do certain things. They still smoking cigarettes.
And they'll tell you not to do that. Is true. And we know alcohol does a lot just alone. So
you're still eating at the fast food places because you want it, because you've got the taste for it, because that's what you grew up on. All of these things. So regardless of what, so science really shouldn't move us, right? These research studies really shouldn't move us. And truth be told, in that situation, when your symptoms are really, really bad, if some guy came up to you in a black hoodie in a dark alley in the middle of the night and was like, oh, I got these little pills, you want to take it or make you feel better? When you're feeling down and out, you would be like, sir, put the pills in my hand. I'm going to take it with or without water, right? Because you endure so much. So you're right. Like, is this what moves us? We act as though it's what moves us, but really what moves us is our turning point.
When for me, I had way too many hot flashes to be able to, working out and going to work. It's just, I made that decision for me because I did, outside of feeling better with hot flashes, but I thought about longevity. My lifespan, health span, that's two separate things. Yeah, being on earth long time, great, but I want to be healthy while I'm here. So that's the thing when it comes to longevity. Life, yes, long term, but am I feeling great? Am I still moving my body?
What's the quality of your life? If you're combusting every 2 minutes, what's the quality?
I'm open to doing the things I need to do to be here, to continue to do the things I love, which is education, especially in women's health, being here with my family and just being able to move my body. Because I get, God allows me every morning. Well, this morning, I can't say he gonna in the morning, but this morning he woke me up to get up and move my body and do the things I wanted to do and be great. So I don't take that for granted. So what I need to do now to help myself later, I'm open to that.
I am open to that as well. And I hope that you all are open to it as well. Like, the conversation alone was changing. It was life changing. So I thank you. Listen, everyone, make certain you check out my sis. She's doing amazing things. You can follow her if you're on Instagram. Make certain you go on there. You follow her on Instagram. She's also on Facebook at Dr. Katashia Wellness Collectors with the K. All right. And follow her on Facebook. And I do have her website going down at the bottom of the screen, drkatashia.com. And just connect, so that you get the information, so that you have a resource where you can get knowledgeable information. And because she's a pharmacist, that's what to me is like one of the golden points of her. She's an amazing woman, but she also has the knowledge of it. So just take a look at her pages and see what she's doing and see what you can glean, and then you can take that information and go speak to your practitioner specifically about it. So thank you so much, Dr. Katashia. Do you have any parting words that you'd like to share with the audience?
One, I just want to thank you for bringing me on. I'm truly grateful. Yeah. And just know that women's health, I know we shouldn't just be suffering in silence. That's it. Please advocate for yourself when you go into the office. Know the information and have a heart-to-heart with your provider.
I love it. I love it. All right, Dr. Katashia, hold on. Hang out for just a second. Let me give the people their marching orders. Listen, that was good. That was good. It was liberating to me. And at least now I have a different conversation that I can go back to my GYN doctor and have. Right. And if they're not the right person to have the conversation with, then find someone else. But you don't want to suffer in silence. Right. And so stop the suffering, because it's not necessary. There are things that we can do that can give us that quality of life that we seek. So I hope that this information was impactful. Make certain you hit the subscribe button and you share. I want you to share this message out with another sister friend, because one of the reasons why people are suffering in silence, because they tell everybody gatekeeping. Well, we're not gatekeeping over here. We are subscribing and we are sharing. So until the next time, I will see you all again soon on another episode of The Black Girl Encourage Her. Take care. Be blessed.